How AI is revolutionizing early diagnosis and disease prevention, today, and over the next decade. Have you ever wondered if a computer could spot a disease before you ever feel a symptom? What if your doctor could predict a heart attack months before it happens? What if Alzheimer's could be detected when the brain first starts showing subtle changes, long before memory loss begins? This isn't science fiction. It's already happening now, and artificial intelligence is driving it. In this video, you'll learn how AI is currently transforming early diagnosis and disease prevention, how major medical institutions and top research universities are validating these tools, and why this technology will reshape healthcare over the next decade. Artificial intelligence in medicine refers to computer systems that can analyze enormous amounts of health data, recognize patterns, and support doctors in detecting disease earlier and more accurately than traditional methods. These tools don't replace physicians, but they give clinicians superhuman pattern recognition and predictive insight. One of the most impactful areas today is early cancer detection. For decades, doctors have relied on human interpretation of diagnostic imaging, which can miss subtle signs that precede disease progression. AI changes this. Research from the Stanford Center for Artificial Intelligence in Medicine and Imaging shows that AI models can analyze mammograms with equal or greater accuracy than expert radiologists, and in many cases, detect abnormalities humans miss. This means cancer can be identified earlier, when treatment outcomes are significantly better. Similarly, studies conducted at Dana-Farber Cancer Institute and Harvard Medical School reveal that AI can examine pathology slides and identify microscopic tumor-related patterns invisible to the naked eye. By detecting these signals early, treatments can begin sooner and with greater precision. On the lung disease front, AI is already being used to improve early detection of lung nodules from CT scans. According to the American Lung Association, algorithms trained on thousands of scans can identify lung changes months before symptoms would normally prompt testing. This earlier detection dramatically improves survival for a disease often caught too late. Artificial intelligence is also reshaping heart disease prevention, which remains the leading cause of death worldwide. Traditional risk assessments focus on factors like cholesterol, blood pressure, and age, but hearts don't follow simple formulas. AI models, developed and validated at centers like the Mayo Clinic and Hopkins University, analyze imaging, genetics, lab values, and lifestyle data to predict heart attack and stroke risk more accurately and earlier than conventional approaches. Research published in the Journal of the American Medical Association shows that combining AI risk scores with clinical judgment identifies high-risk individuals earlier and more reliably. Neurological diseases such as Alzheimer's and Parkinson's have long been difficult to detect early. Often symptoms only appear after years of underlying progression. But that is changing. Investigators at the University of Toronto and the Rotman Research Institute have trained AI systems to detect subtle brain changes associated with Alzheimer's using MRI scans and cognitive data. In several studies, these models identified early markers years before clinical symptoms, opening the door to earlier intervention and better long-term management. Another major breakthrough is AI's ability to analyze routine blood tests for subtle disease signals. Researchers at the National Institutes of Health developed an AI model that detects early signs of sepsis, a dangerous and rapidly progressing whole-body infection, before visible symptoms appear. Hospitals using this technology have been able to intervene earlier, improving outcomes and saving lives. Artificial intelligence is also advancing diabetes and metabolic disease prevention. Type 2 diabetes often goes unnoticed for years, but AI models analyzing continuous glucose monitoring data along with diet, activity, and sleep patterns can predict glucose spikes before they occur. Research published in Diabetes Care shows that AI-guided feedback helps individuals stabilize blood sugar more effectively than standard dietary advice alone. Leading medical centers like Stanford Medicine and Massachusetts General Hospital are already piloting tools that integrate wearable data with clinical records to alert patients and clinicians before dangerous metabolic events occur. These systems do not replace medical care, but they provide early warning and actionable insight that wasn't possible before. So why is AI so powerful for early diagnosis and prevention? Because diseases often begin long before symptoms appear. The earliest signals, subtle cellular changes, microscopic tissue patterns, gentle shifts in blood chemistry, are too complex for humans to detect unaided. AI excels at recognizing these complex patterns across thousands of data points in seconds. Major health organizations, including the World Health Organization, the National Institutes of Health, and the American Heart Association are now exploring and supporting AI tools for early detection and risk prediction. These organizations fund research, validate algorithms, and test AI alongside traditional diagnostics in clinical trials. But it is important to be clear. AI is not perfect, and it should not be used in isolation. It works best as a partnership with clinicians. The goal is to enhance human expertise, not replace it. Ethical implementation, data privacy, and ongoing validation are crucial to ensuring that AI benefits everyone and does not widen existing healthcare disparities. Looking ahead, over the next decade, we will see AI continue to improve early diagnosis and prevention for a broader range of diseases. We may see AI-assisted biomarkers for autoimmune disorders, predictive models for psychiatric conditions, and diagnostic tools that integrate genetics, wearables, and environmental data to forecast disease risk before clinical symptoms emerge. The future of medicine is not reactive, waiting for symptoms to appear, but proactive, predicting risk and preventing disease before it starts. This shift will improve outcomes, reduce costs, and ultimately extend both lifespan and health span. If this video helped you understand how AI is transforming early diagnosis and disease prevention, let me know in the comments which application surprised you the most. Like the video if you found it informative, subscribe for more science-backed insights on medicine and technology, and share this video with anyone curious about the future of healthcare. The next decade of medicine is being written right now, and artificial intelligence is helping doctors detect and prevent disease earlier than ever before. Stay curious, stay informed, and take care of your health with intention.